Some trauma symptoms could be physical. Headaches, weight loss without dieting, so you don't want to eat because you're feeling sad or anxious or just really traumatized from something recent that happened usually. So that could be a sexual trauma. More traumas happen to women that are sexual traumas caused by usually their partners or people that they love, or sometimes they're date raped, or sometimes it's a stranger, but often it's men that they know. So weight loss is a symptom, insomnia, having trouble getting to sleep, not sleeping enough, waking up in the middle of the night and not being able to go back to sleep. I have those problems sometimes. Doctors are recommending now that adults get 7 to 8 hours of sleep at night. I hardly know anybody that gets that much sleep. But if you want your body to be really healthy and your mind and your emotions to be really healthy, we need a lot of sleep. But if you've been traumatized, getting enough sleep is really, really hard to do. Sexual problems. So if you've been traumatized in a sexual way, or even if you've been physically abused or mugged or robbed, you could develop sexual problems. And this could be a fear of men, fear of the opposite sex, fear of women, if a woman was a perpetrator, or if the woman was somebody that you told and they didn't believe you or put you down or told you just get over it, or that kind of thing. You could have problems then, trusting women. Trust is a huge thing when people have been traumatized. It's really, really hard to trust after trauma, but that's an important thing to work on. So having nightmares and flashbacks is one of the symptoms. Nightmares will be exacerbated by the trauma. It's normal for kids to have nightmares. It's normal for adults to have nightmares, especially if life isn't going too well, or you watch the news too much, or you watch really scary movies. But nightmares that have to do with trauma or prompted by trauma are a little bit different. So take a look at your nightmares. Flashbacks. A flashback is a memory of the trauma. So it could be coming up from your subconscious. You could be trying so hard not to think about the trauma, but you keep having memories of the trauma. And it's not just people that have been in combat. That is a classic shell shock PTSD symptom, but you could have flashbacks that just startle you and make you feel really uneasy and frightened and unhappy and depressed. So flashbacks are a huge problem. Having anxiety attacks, panic attacks. Sometimes panic attacks feel like having a heart attack, and it's very scary. A lot of people go to the ER when they think they're having a heart attack, but it's an anxiety attack. It's a mental problem that can be helped with therapy. So that's all I'm going to talk about today, is these particular symptoms that you might have as a result of trauma. But I want you to know that getting help from a qualified therapist is really important. I've been doing trauma therapy for over 20 years now, and have helped thousands of people to get over their trauma. So if you would like to get help from me in taking a course and getting a support program, I have my program, Essential Mastery, that is closed now. It closed on Friday, but we will reopen it again in a couple months. But go ahead and get on my wait list, get the free PDF that I created for you, Ditch Your Trauma. And also when you get that, you will get access to a free webinar that will talk about any of the symptoms of